just hearing her story and having her cry in my chair, that was challenging. Like being able to pull that together in the emergency department, it goes one way or another, and you don't see that person usually again.
Welcome to the Beauty Talk podcast, where we feature how the best medical practitioners help their patients to look better, younger, and healthier. Now, enjoy the show, and here's your host.
Daniel Gao here. I'm the host of Beauty Talk. We feature the top medical practitioners in health and beauty, both inside and out. I have Wendy Pickett of PDX Injects and Complete Aesthetics Training Institute. She's a registered nurse with over 20 years of experience in the emergency department. In 2012, she entered the field of aesthetics part-time while continuing to work in the ER. In less than a year, Wendy was co-owner and primary injector at a successful medical spa. Wendy's passion for aesthetic treatments has evolved over the last decade, and she now trains healthcare providers all over the US. Wendy offers a wide variety of expertise in aesthetic treatments, her favorite being PDO threads. So Wendy, welcome and glad to have you here.
Thank you for having me.
Yeah, so let's dive right into it. How did you first get interested in medicine?
In medicine in general happened probably when I was a little kid, just feeling that nurturing need to just take care of other people. So as it evolved over into high school and then college, I naturally just fell into a path of getting into nursing, and I loved it. And I immediately discovered that the emergency department was where my passion was truly apparent. It was, and people all ask me all the time, they're like, "You're an emergency department nurse, you must be an adrenaline junkie." And I'm like, "No, I just have a really short attention span." So being able to, I think, innately multitask led me to the ability to really excel in the emergency department, which has really paved the way also for what I do now, because I manage so many different things. It's every day is a juggling act, and I love it.
Yeah. And so how did you make that transition? I mean, you were in the emergency room. How did you make that transition over to aesthetics? I guess what got you interested in aesthetics in the first place?
I got incredibly lucky. For starters, I love when people ask, "How did you become successful in business?" And it really is true that such a broad stroke of it is luck. I had a partner, well, not a partner, but a colleague who had the opportunity to purchase a med spa. And he was a physician, and he phoned me and said, "Do you want to be my Botox nurse?" And this would have been in 2012. So at that time, aesthetics wasn't as widely known as it is now and as publicly accepted. And I said yes, because I was very eager to get out of the emergency department at that point in my career. And not knowing what being a Botox nurse meant, I dove right in. And he ended up not purchasing that med spa. But by that time, I'd figured out how to obtain my training, how to open up a location of my own. I had met two people to partner with. And from that initial conversation with him, it was about 6 months before I opened up my own full-fledged med spa with him as my overseeing provider. So yeah, very lucky, but a lot of ambition, determination, drive.
Mhm. Wow, that's incredible. Now, with the treatments that you provide in your practice, I know we mentioned in the introduction that PDO threads was one that you're really, really passionate about. Talk a little bit about PDO threads. I think PDO threads has kind of gone through these different phases. It was popular way back in the day, then it kind of lost popularity, and then it seemed like it started to have more of a resurgence over the last several years. So can you talk a little bit more about PDO threads? Like, what are they and what is the best use of them?
Absolutely. PDO threads are my favorite treatment to do on myself and for my patients. It's also my favorite thing to train. They're polydiaxanone threads. And the name is misleading. It's not thread, it's actually a dissolvable suture. So we've been using the polydiaxanone dissolvable sutures in cardiothoracic and gastrointestinal surgeries for decades. So these are proven devices, is how it's cleared through the FDA, and very super safe, like incredibly safe. So when I first became familiar with them was in 2015, when the first PDO dissolvable suture threads for the aesthetic purposes became popular, became approved in the US. So I jumped right on board. The thought of being able to lift some sagging skin in the face intrigued me, and I knew it was something that my patients would love. And not only that, I had started teaching other providers at that point. So I knew right away that I wanted to teach other providers how to use the polydioxanone threads, and they weren't real popular then. I thought they were going to just take fire. I thought everybody was going to jump on board with them, and that did not happen. It was a very slow growth.
Mm.
And we did have a resurgence when I became a trainer. At one point, I was traveling all over the US training other providers 3, 4 times a month. And now it's really slowed down. And I attribute that to being that there's so many options for patients out there. And there's so many options also for providers. But there was a lot of misinformation
Mhm.
that led to a decline in the popularity. And my hope is that it'll just start getting more and more popular because the PDO thread treatments are safer than dermal fillers, which is so important for providers. And they give an immediate result and they give a long lasting result. So my patients can actually experience something that looks similar to a facelift without having the complications and the risks and the cost.
Yeah.
So I think that that's where a lot of the misinformation is about PDO thread specifically. I'm not trying to replace a facelift. If I think my patient needs a facelift, I'm going to refer them to my favorite plastic surgeon. But if I think that I can help them achieve what they want without the risk and the complications and the money, to be honest, I will present them with that option as well.
Okay. Now, what would you say would be the key differences if someone's considering a facelift versus a PDO thread lift? What would be the key differences of which way you would guide them one way or the other?
It definitely is a patient selection process. If somebody, I say a Shar Pei, if somebody looks like a Shar Pei, they've got very heavy, drooping skin, those people would be better off having a facelift, making that investment if they really want that look of turning back the clock 20 years. So really heavy skin, lots of folds, lots of wrinkles. If they are okay with plastic surgery, that's a great option for them at that point. On the other end of the spectrum are my patients that I call my wrinkled raisins. And that's those patients that look like a deflated balloon or a wrinkled raisin, and they really need more volume. They need more filler or our biostimulators that are getting so popular right now. I just love that. So they need some treatments ahead of time before they'd be a good candidate for the PDO threads. But anybody in between those two extremes, perfect candidates for a PDO thread lift. And any age range, really. I have people ask me, what's the youngest you've ever done a PDO thread lift on? And it's probably around 25 years of age, but all the way up to 80. So anywhere in between. And we can always use we have another version of PDO threads that can actually stimulate collagen. So we can use those on one end of the spectrum and get their skin more viable so that when it becomes more elastic or has more strength, then we can use the threads to lift at that point. So it's just such a great treatment for really so many people.
Okay. And how long does the treatment last? Like once you get it, how long does it last for on average?
So the treatment itself takes about an hour to do the procedure and there's no downtime. My patients will go back to work often. There's no bruising. There's definitely some swelling and some decreased activity level for a couple weeks. So you see that immediate lift. It's incredible. And then those results, the tensile strength of the actual lifting threads, that will be in effect for minimum 9 months. So those threads are still doing what they're intended to do with the proper quantity and placement for 9 months. So at that 9 month point, the tensile strength, so the threads start to lose that lifting capability and our body just naturally starts to break it down, which is amazing. But we still have those threads in there and our body's reacting to them and stimulating collagen, which is the huge buzzword term in aesthetic medicine now is all about stimulating collagen. We know how important that is to retain that and to grow more as we age. So those threads are stimulating collagen, and that collagen that's stimulated can last for 2 to 3 years. So I have patients who hear me say, oh, you'll start to have a little bit of letdown at around 9 months, and they're back in my office at 9 months because they don't want that to happen. They want those results to maintain that same effect. And then I'll have those other patients who are like, oh, Wendy said this should last around 2-ish, maybe 3 years. And maybe I see them every 2 to 3 years. But the more average is about every year. So at about a year and a half, I'll see my patients that are very committed to the PDO thread lifts come back for another treatment. And the really, I think the best thing about it is 5, 7 years ago, maybe a little bit more, maybe even a little bit less, we were seeing the pillow face look. So that overfilled look. And I don't like that look. It doesn't look natural. So rather than filling this way with the hope that makes it look lifted, we are actually using the threads to do that lift. So I tell my patients, your filler tank is full. If they're like, full, give me more, give me more, give me more, I'm like, your filler tank is full. So now it's time to lift those threads, which is a much more natural look.
Okay. And you did touch on this a little bit, but I want to dive deeper into the treatment being non-invasive. Because you mentioned like people really don't have downtime. They can go back to work right after. You said there's a little bit of swelling, but I mean, for the most part, they get the treatment done and they're on their way. So especially compared to something like facelift, which I think is a big, I mean, aside from the price, but also some people are scared that if they do a facelift, it's more invasive. Thread lift is considered non-invasive. So you can talk a little bit about that. I'm sure you have people coming in, they're kind of worried about the downtime, the invasiveness, and that's why they consider the thread lift. So what do you tell people that have that fear or that concern?
Most people, when they have the fear or they have a lot of anxiety about a PDO thread lift, it's based upon the pain factor of it. It's really not so much a downtime thing. The patients that I see predominantly also are familiar with our entry level treatments like neuromodulators and dermal fillers. So typically they're not coming in with never having had anything done and being like, give me a PDO thread lift. So the pain factor is really more of their consideration, but it is very similar to a dermal filler treatment. We also have anesthetic that can really make the procedure very comfortable. There's also things like nitrous oxide that our patients can inhale during the treatment that also decreases their anxiety level. So it is something that is 100% so much different than a surgical facelift that you have to do pre-treatment for. There's a lot of cutting. With the PDO threads, we simply make a hole. And through the hole, we insert a cannula in which the PDO thread is loaded. The metal cannula comes out and the thread is left behind. So it's so different than a surgical procedure, which is why there isn't that kind of 6 to 8 to 12 weeks of downtime, which is typically expected with a surgical facelift.
Yeah. Okay. Now, are there any misconceptions that we haven't talked about already when it comes to PDO thread lifts that your patients, your clients come to you for, and they just have this myth or a wrong belief or misconception about it? I know you talked a little about in the very beginning as far as some people had that, like there was some bad information going around, but is there any other, like, what are the common misconceptions you hear?
The biggest one is that a PDO thread lift will create scar tissue that will make it that a plastic surgeon later will be unable to actually do a facelift. So it's a really nice bridge for people who are like, I want a facelift, but maybe I don't want it now. I want to wait 5 years for maybe a facelift. And doing a PDO thread lift at that time is a perfect bridge until somebody is actually ready for that surgical procedure. But some of the misinformation does actually come from our plastic surgeons who maybe see that a thread lift is encroaching upon their business, which it is absolutely not. I actually know many plastic surgeons who augment their surgical facelift with the PDO threads. So while they're doing the cutting and the maneuvering of tissue and fat pads during a surgical facelift, they will enhance that with the placement of some PDO threads as well. So that, I think, is the biggest misinformation, that if I do this thread lift now, I won't be able to have a facelift later. And that is the biggest inaccuracy that I hear.
Wow. Okay. That's really good to know. I would have never thought that people would have that kind of impression on it, but I'm sure that some are thinking about it. Now, I want to jump over to your training academy, your institute. How did you first get started? You talked a little bit about like now you teach, but how did you first get into that, I guess, the desire or start deciding that you want to teach others?
That was another a little bit less of a stroke of luck and a little bit more strategy because I've always loved education. For a little bit, I taught high school health occupations, and that was my first taste of being in front of people and seeing the engagement and having their eyes lock on mine and feeling that high, that rush of imparting whatever knowledge I had to impart and seeing people really like hang on my every word. And it was really my high school students who I would show up on Monday morning after a weekend in the emergency department because I did both.
Mm.
And they'd be like, we'd have, the curriculum that we needed to go over. And they'd be like, wait. Like, didn't you spend the weekend in the ED? And I'm like, yeah. And they're like, well, what happened? Like, tell us about that. And that sharing my experiences in the emergency department just it was more knowledge than any textbook could give them.
Mm.
So that's when I first kind of saw that link. And
Mm.
so as I got better and better in aesthetic medicine, and I saw this gap in aesthetic medicine, that there weren't great trainings. My training initially was not awesome. It was very short. I had very little hands-on experience during my training session in neuromodulators and dermal fillers. And so I saw this huge gap and I wanted to make it better. And so myself and my colleague at the time, my partner in my training business, she was like, we can teach this. Why aren't we teaching this stuff? And just it was like the biggest light bulb moment I've ever had. By the time I had left her and arrived at my house 2 hours later, I had the business name, I had the business model. I had already in my head started working on the curriculum, the didactic, what I was going to do with this training program to make it better, like 10,000 times better than what I had initially experienced. And it just grew from there. And we started adding to the neuromodulators and the dermal fillers, started adding PRF and advanced procedures and biostimulators, and then the PDO threads. And the other thing that I really wanted to do was create something that was product neutral because thank goodness, we have many options now that we didn't have in 2012. There's more neuromodulators, there's more dermal fillers, there's more pharmaceutical companies now that we have to choose from. Having said that, they all have their way of doing things and their different nuances and the way that they try to steer what medical providers do. And I just feel that that is just wrong, that we as medical providers have the ability to do what's best for our patients, not based on what the pharmaceutical companies are telling us. So while we all have our favorites, I love them all, they all are great, but I really wanted to be product neutral. So I teach my students all the things. They're going to learn all the options. And when I graduated from my training program, I didn't know that at all. I didn't know what I didn't know.
Mhm.
And so that was a huge objective for me, probably the number one objective. Well, number one objective is to train safe providers. Number two is to show them all these options that they have available. And once I started making that connection, it elevated my practice. It made me a better provider. And honestly, it made me more successful monetarily as well, because now I had all these options, some high price, some low price, some right in the middle. And just being able to explain all that to providers has been extremely helpful.
Okay. Now, with training programs, there's a lot of training programs out there. So I want to understand a little bit more of what's the biggest benefits that a medical professional would get by going through your specific training programs?
Yeah, I love that question because going back to what I didn't get at my initial training as adult learners and as medical providers from, especially me coming, well, not especially me, but people who come from a strong clinical background, we get stuff like, but the repetition is what we really need. So understanding the physiology, how it works, what medications do what, and where to place them, that's kind of the easy part. But the repetitiveness of it is key to coming out of a training program and feeling competent. So our training program is 8 hours of hands-on with your neurotoxins and small groups. So if you're attending my class, you're going to spend 8 hours injecting neuromodulators at every 30 minutes, a new model comes in. You're likely going to get your hands on 16 models and seeing different faces. So seeing 16 different faces, which was another gap, was like, how do I know what they need? Like in the emergency department, I wasn't thinking about their face and where I wanted to put some neurotoxin or dermal filler. So having that repetition and having that quantity of models in your training session, just over the past 6 years, I am now turning out providers that are like, I got this. I like understand it. I know where to put it. I know my anatomy. I know how to assess my patients and do the right prescription for them. And now I have the ability to the muscle memory of injecting all day long, of knowing the skills. And we repeat that in our second day of the clinical portion of our training program with the fillers. So we spend more time, it's a more complex procedure, so an hour per patient, but we see 8 to 10 patients, and everybody gets a huge amount on hands-on time with the dermal filler. So that is the key, that when people ask me what's different about your program, would be the hands-on clinical time.
Got it. Okay. Now, I'm curious, Wendy, what role do you believe creativity, artistry, things like that play in not only how you approach your own specific patient care, but also how you teach that to your students that come through your classes as well?
Such a great question. And I just was having a discussion with a colleague that I respect very much, who's in the aesthetic recruitment end of our business. And so she actually recruits medical providers and goes through a whole list of questions to determine whether they would make a good aesthetic provider for whatever office or just in general. And one of the things that she touches on is called aesthetic aptitude. And I adore her and respect her very much, but she says that just can't be taught. That is something that is just naturally in somebody, that they have aesthetic aptitude and they just can see the shadows and the nuances of someone's face, and they just innately have that sense of what looks beautiful. And I disagree with that. I think we can teach people that. I didn't have that. I was never somebody as I was growing up, and I'm, not in that age range that we didn't know about skincare. We weren't doing selfies. We didn't have cell phones when I was in high school. So that's how far I go back. So I didn't pay attention to those things when I was in my late teens, early 20s, and now people do. So when I have a provider who comes through that is maybe already has a background as an esthetician, and they went and got their nursing degree and now they want to start doing injections, I'm like, oh my goodness, like I kind of already know that person is going to be very familiar with the curves and the shadows and the asymmetries and what our versions of beautiful constitutes. But that doesn't mean I can't also have a labor and delivery nurse come through who doesn't have that same perspective, and they can learn that. They can really do a deep dive into patient's anatomy and learn all those different things that lead them to developing great treatment plans for all their patients. So from the aesthetic point of view, everybody can become that kind of provider that gives exceptional treatments.
I think it's a great way of looking at it, because I can see from her point of view also. It's like, I feel like, man, it's tough to teach art. It's like my artistic skill, like I have trouble drawing stick figures. So for me to be able to think that I can learn how to be more artistic or have that eye, it's hard for me to imagine. But I mean, you've gone through that yourself. So I mean, I think it's very inspiring. It's very there's hope if a provider feels like they're not very artistic, but they want to be very successful in this field.
Absolutely. And at the end of the day, it's a medical procedure. So, and that needs to be the thing that we're thinking about first. But it's just this amazing blend between creativity and science. So when I see that light in my students, that is also like a great aha moment for me and for them, because at first it seems it's almost insurmountable. Like my clinical background, let's even take like one of the best injectors, one of the best students I ever had was a doctor who did geriatric care. So like not, in that setting, not looking at the aesthetic of his patients at all. And he was one of the most highly skilled students I've ever had. Not only did he have the clinical background and the dexterity to administer these medicines to his patients' faces, but he also was able to really pick up on the different shadows and where he should put the filler to create the look that the patient desired and that he was guiding them toward.
Mm.
And it was another example to me that you don't have to be like born with this aesthetic aptitude, or it's not something that you maybe innately know that you're creative. Also, having said that, there are several plastic surgeons, Dr. Jonathan Sykes being one of them. And there's also a cosmetic dentist in Beverly Hills, another one, Dr. Lawrence Rifkin, who both have this amazing artistic side. They both are artists and sculptors and like do all this exceptional artistic work. So seeing that blend of it all come together in someone's face and or body as a body plastic surgeon does is pretty incredible.
Wow. Okay, that's good to know. It's good to hear also. Now, Wendy, I want to go back to the to your patient and to your client side. Throughout your experience, I'm sure that you must have had some really challenging cases that you've had to work on. Is there maybe one story that you can share that's just either a very memorable case or a very challenging case that came into you and how you were able to get them a great outcome in the end?
So the word challenging cases is interesting. Challenging, again, this is a medical procedure. So luckily, we have the track history of being able to look back and refer to other things, right? There's been people who have paved the way. So when I think about something that's challenging to me, it's more of the things that pull at my heartstrings. It's the people, the patients who maybe were difficult patients in terms of how they expressed what they wanted as their outcome and how maybe something was lost in translation and I wasn't able to give them that, or my opinion was I gave them that, but for whatever reason, they didn't feel like they had the desired outcome. Those patients have been very few, like very few. The patients that I find more challenging are the thing that I didn't expect, and it probably happened my very first week that I was doing aesthetic medicine in my own med spa. And I had a patient come in whose husband had just passed. And I'm an emergency department nurse, so I'm pretty used to emotional situations. But having the attention of this woman and just hearing her story and having her cry in my chair, that was challenging. Like being able to pull that together in the emergency department, it goes one way or another, and you don't see that person usually again. But in this scenario, in aesthetic medicine, I want to see that woman again. So it becomes this blend of emotional support and doing what I can, even if it's just 20 units of Botox in her glabella to make her look not so sad, and seeing the joy that just those little treatments give to people. So I could give you so many stories similar to that. I had a friend group who had their best friend had breast cancer, and it was clear that she was entering her last days, and people loved and adored this woman. And so all these people were coming to see her to say their goodbyes. And how, like, I'm getting emotional just thinking about this story. It was so dramatic and lovely. But she felt like she always took really good care of herself, and she felt like she just looked horrible.
Mm.
And so her friends put her in an RV, drove her an hour. I went out into the RV to do a cosmetic medical aesthetic treatment on her. So in her last few months, she felt like she looked better to say her final goodbyes. And that, like, when you ask me, like, what was the most challenging thing or the most challenging patient, I think of stuff like that. Like that was something similar that I had experienced in the emergency department and that I didn't realize would be as professionally fulfilling and as personally fulfilling. Like I'm not saving lives, but I'm giving people something else.
Mhm.
And that's like hope and just a better sense of self and just seeing that difference, that the little things I do that can help.
Yeah, and I think you worded it perfectly, giving people hope, is I think that's something that people should look at the aesthetic industry like that. It's very much you're giving people hope, you're giving them the confidence Whereas I think some people would look at the aesthetic industry and be like, oh, it's just about maximizing your beauty. It's all about vanity, but it's not about that at all. Like whenever I ask this question, like what's the most memorable story? It's always something very emotional, something where it's just people just want to feel like themselves again, or just want to get their confidence back, or just want to have that hope. It's not about, oh, I want to be the most beautiful person on the planet. It's never that.
No, it's never that.
So I think you really hit a good point there.
And the other thing that really stands out to me is how the aesthetic medicine specialty has changed over time. I was at a conference for graduating nurses, and I was sitting beside a pediatric ICU nurse and a trauma nurse and like a forensic nurse. And then I was there, and we were each talking about our specialty and what we did. And as they went down the lineup, I was like, my name's Wendy. I do Botox and filler. And I got a huge laugh from the crowd. But I said, but it's a lot more than that. And our medical specialty has developed into so much more of a holistic area of treatment. So we're doing health and wellness, we're doing IV hydration, we're doing hormone replacement therapy, we're doing medical weight loss. We're doing so much more than we were 20 years ago, that it's not just something that's superficial. We're
Yeah.
treating a person.
Yeah. And that's a great segue into this next question. I'm curious where you think the future of aesthetics is going, aesthetic medicine is going, particularly with regenerative medicine now starting to come into play. You already talked about some things that I'm starting to see also with practitioners bringing to the practice, the wellness side, the weight loss side, the IV side, the functional medicine side, and also the regenerative medicine side. But could you talk a little bit about that, particularly looking at regenerative medicine? Like what is it and how do you see it fitting into the future?
We're seeing regenerative medicine, just all these new innovative things that are just bombarding us right now in aesthetic medicine. And it can be a little murky. It's a little bit hard for providers to navigate that. I do see people maybe pushing the envelope a little bit and doing treatments that aren't yet FDA approved. Having said that, the things that are FDA approved that we know are tried and true are autologous. So I love the autologous treatment. So using a patient's own growth factors to stimulate whatever, whatever they want to grow at that point, whether it be collagen or hair. It's amazing to see the differences that we can make when we drop our patient's blood, spin it down, extract the growth factors, and then re-inject that or apply it to the patient in a way that gives them that regenerative look in a much more natural way than dermal fillers or our neurotoxins do. So it is clearly very innovative. The stem cell treatments have been around for quite a while, which are still not approved here in the US. So there's still a lot of trepidation. I still express a lot of caution to providers in that way, but it's definitely like this huge growing piece of our pie. And it's definitely one of the things that if aesthetic medicine specialists, providers are not integrating into their treatment menu now, it's something that they need to do if they intend to be successful from now until whenever the end of their career is. It's just going to blow up and get bigger and bigger because natural is just better. Putting something artificial in your body doesn't make as much sense, doesn't make any sense if you have a natural alternative.
Yeah. Okay. Got it. And then also speaking about the future, I'm curious, what is your vision for your businesses, for the PDX Injects, and then also your training company as well?
So my visions for my med spas is to pass that on to the next generation. I would love to, at some point, just like hand it over and be like, here you go. And I love seeing my patients. I'm very grateful. I've got patients who've been seeing me since I started in 2012. 13 years later, they're still coming to see me. We've been in each other's lives through marriages and divorces and kids and all the things. And that's part that I'll miss. I never want to stop teaching, and I never want to stop encouraging other medical providers to follow their dreams and be ambitious and be entrepreneurs if that's what they want to do. And I didn't think about any of that when I was going in nursing school. I just thought I'd be a nurse in a hospital for the rest of my career. And there's so many more choices now. So I definitely see the med spas that I own as passing that on, hopefully to the injectors that already work for me. I would love that. But the training side of it, I'll never stop doing. I initially thought at one point that I wanted to retire. And now I meet people in their 70s, in their 80s, and they're still working by what, a definition of working. They're doing things that generate an income, but it's what they're passionate about. It's what they love.
Mhm.
So I don't see myself ever stopping that to some degree. And I love to golf. I used to say I want to golf just every day. And I'm hoping that I can have that balance between golf and teaching, because that's really what energizes me and feel like that's what keeps me young and youthful and vibrant. And that's my goal.
It's an awesome goal. It's an awesome vision. Now, Wendy, I have one last question for you, but before I ask it, I do want to point people to your websites at pdxinjects.com and completeaesthetictraining.com. Now, last question is, what does beauty mean to you?
Beauty, as soon as you said, like, as soon as I heard that question, I just like my brain just went inside.
Mm.
And beauty to me is that internal version of what we desire. So the term beauty is in the eye of the beholder is 100% accurate. So using a formula to determine beauty, or symmetries or asymmetries, or whatever, society is telling us is our definition of beauty, I argue against that every day, all day long. Beauty is really what's within all of us, and like realizing that within ourselves and how we want to achieve that and portray that on the exterior is so individualized. So I just think beauty is something that's innately in all of us, however we choose to express that.
Awesome. Well, there you have it. Wendy sharing your expertise. So, Wendy, where can people contact you or get more information about your businesses and what you do?
Super easy. I am all over the internet. So I on TikTok at Chalks Trainer Wendy, on Instagram Complete Aesthetics Training, website and Instagram PDXINJEX for patient treatments. Yeah, it's difficult to not find me. So just reach out.
Awesome. Well, Wendy, it was a pleasure having you here on the show. Thank you so much for sharing your knowledge, sharing your wisdom, and just sharing your message to the world.
Thanks so much. Thank you for having me.
Thanks for listening to the Beauty Talk podcast. Any questions, please contact the practice directly with the contact information provided during the show. We'll see you again next time. Bye for now.